in PARALLAX, we had two primary readouts. We had the co-primary, which was the change in NT-proBNP from baseline to week 12 of therapy. And we had the change in 6-minute walk distance from baseline to week 24. And we always assess the difference between the sacubitril valsartan arm and the individualized medical therapy arm. And yes, we had a significant effect when we looked into NT-proBNP. There was a significant decline in natriuretic peptides in the sacubitril valsartan arm at week 4. And that was already statistically significant, the difference to the comparator. And there was a statistical significant difference at week 12 with lower NT-proBNP values with sacubitril valsartan. And this is consistent with previous data, for example, from the phase 2 Paramount study. Then we also looked into 6-minute walk distance. And here we saw an improvement in 6-minute walk distance by roughly 10 meters in both groups, in the sacubitril valsartan group and in the comparator group. This difference at week 24, however, between the two arms was not significant. So no impact on 6-minute walk distance, significant impact, benefit reductions in NT-proBNP. These are the key results from PARALLAX. So when we looked into quality of life parameters, the measure was the Kansas City Cardiomyopathy Questionnaire clinical summary score. This was our key readout here, KCCQ CSS. And again, we had several time points where we assessed KCCQ, baseline, week 4, week 12, 16, and 24. And we had an interesting finding. We saw that quality of life significantly improved over time in both arms. There was a significant difference in favor of sacubitril valsartan after week 4. The difference between the two arms became smaller at week 12, 16, and 24. And at week 24, the difference was not significant. So early benefit on top of the overall improvement in this score. And at the end of the study, after week 24, no further significant difference. That is for KCCQ. When we looked into New York Heart Association class changes, 1/4 of the patients in the overall cohort improved, 3/4 did not change, a minority deteriorated, but no significant difference between the two arms.